Erectile dysfunction ED is more common than you might think, affecting up to 71% of men aged 40-80. It's not just a physical issue, it deeply impacts psychological well-being and quality of life. While age is a significant factor, ED isn't exclusive to older men. Younger men are also affected, highlighting the widespread nature of this condition.
ED can signal systemic health issues like cardiovascular disease or diabetes. It's often the first warning sign of these underlying conditions.
Psychogenic factors, including stress and anxiety, also contribute significantly to ED. Understanding these causes is crucial for effective treatment. Diagnosis starts with a detailed clinical history and questionnaires like the International Index of Erectile Function. These tools help assess severity and guide treatment.
Advanced diagnostics include blood tests and imaging like penile duplex ultrasound. Emerging tech such as wearable devices offers new diagnostic possibilities.
Lifestyle changes are foundational in managing ED. Regular exercise, a healthy diet, and stress reduction can significantly improve erectile function. Phosphodiesterase type 5 inhibitors, PDE5S, are the first-line drug treatment. They are effective but may require combination strategies for non-responders.
Regenerative therapies like shockwave therapy and stem cell treatments show promise but remain experimental. Rigorous trials are needed to validate these therapies.
Novel drug targets and medical devices are being explored, offering hope for future treatment options. However, more robust data is essential before widespread use.
Penile prosthesis implantation is a viable option for refractory ED cases. Advancements in implant technology promise higher satisfaction rates.
Tailoring treatment to individual needs is crucial. As we explore new therapies, understanding patient expectations will guide future directions in ED management.